Okay, so we're about 20 hours status post me injecting 8 syringes of Juvederm into my face to deal with the area underneath my eyes and my malar area. As you can see, there's really zero bruising whatsoever on this side. There's a little bit of superficial skin marks from the injection sites. There's not a single bruise on this side of my face. No bruises whatsoever. Just a little swollen as we expect in the first 24 hours status post Juvederm. If you look at this side of the face where I inserted a needle without injecting the anti-bruising filler, you can see that I have a nice shiner there. This bruise is not very severe compared to what it would have been if there was no anti-bruise formula in my tissue at the time. However, if you put a needle in a person like me with very thin skin, with very little fat between the skin and bone, and a lot of the periorbital veins there, you're going to hit a vein and the vein's going to immediately bleed and cause bruising. As you can see, if you inject the anti-bruising filler, every time you put the needle in, you don't bruise. The only bruising that you get that you're not going to be able to combat is those intradermal fine little vessels that you see marking right there. But the whole lid, this is where we usually get the black guy, the shriner that goes around that zone of adhesion of the orbital septum to the malar eminence of the maxilla, and there's none. And here we got just a little bit. So I did this self-injection for a number of reasons, one of which is to enter the world of what the experience is like for my patients, so I can relate to them and assure them more convincingly, and I know that I understand completely what they go through because I become my own patient. Another reason I did this is because even though most patients come to me, come through word of mouth with very nice recommendations, and that's why they come to my office in the first place, a lot of people are taken aback when I say I want to put 5, 6, 10, 12 syringes of Juvederm in their face. What the public's exposed to and really what other practitioners practice, this is ridiculous, and other practitioners think this is ridiculous. What I do is so different from what's done by the standard injector that I really need people to understand what it is that I'm doing, what I call aesthetic facial balancing. So I'm balancing my own face, not because I particularly care to change my appearance, but to use myself as an example to explain this is me with 8 syringes of filler, and I'm going to complete balancing my face as I would recommend to a person with my face walking into my clinic, and I think we're going to end up around 15, 16 syringes by the time I balance my upper third of my face, the lower third of my face, and the little details. So what I thought was going to be a 2 syringe inject myself because I recommend these injections to my patients is turning into 15 syringe facial balancing. So we'll see how that goes, and here we go.